For decades, mental health care has been stuck on a really tough problem. We're often just treating symptoms without ever knowing the real cause. But what if that could finally change? A brand new approach, one that's powered by AI, is trying to do just that. And it all starts with one single, powerful number: 40%. Just let that hang in the air for a second. What on earth could that be? That's the percentage of people who just don't get better with our current treatments. 40%. I mean, think about that. That means almost half the people who are brave enough to ask for help get stuck in this awful loop of suffering, misdiagnoses, and therapies that just flat out don't work. This is the exact problem the Neuroanalytic agent was built to solve. So why? Why is that number so tragically high? It's not because clinicians aren't trying their best. It's because of a fundamental issue baked right into how we practice psychiatry today. It's all based on trial and error. Right now, the standard of care is, well, basically a series of educated guesses. Because for most mental health conditions, we don't actually know the root cause, the etiology. So doctors have to try one medication, see if it works, then another. Try one therapy, hope for the best. For the patient, this can mean months or even years of just waiting. It's a huge burden to carry when you're already struggling. And this cycle of guesswork doesn't just hurt the individual. When you zoom out and look at the millions of people affected, you realize it's created a staggering global crisis with massive financial and social costs. Just look at this forecast. By 2030, the global economic toll of mental illness is projected to hit $16 trillion. No, that's not a typo. $16 trillion. That number is so big it's hard to even wrap your head around it. And that's not just treatment costs. That's lost productivity, it's the strain on our communities, everything. And you can see this playing out everywhere. In the United States, major depression is one of the most expensive conditions to manage, period. Over in Europe, we're talking about 165 million people affected every single year. And in a single country like France, the cost in lost productivity alone is 170 billion euros annually. The system is just buckling under the weight of all this uncertainty. Okay, so if the whole trial and error model is broken, where do we possibly go from here? Well, the answer requires a huge shift in thinking. We have to stop chasing symptoms and start finding the cause. Let's just quickly nail down this key term: etiology. It sounds technical, but all it means is the root cause of a disease. You know, in the rest of medicine, this is how we do things. A virus causes the flu. A blocked artery causes a heart attack. Psychiatry has been the odd one out for a long time. But this new approach wants to finally change that. And this really puts the difference in sharp focus, right? The old way is all about guessing and managing symptoms, which is exactly why the failure rate is so high. This new etiology-first approach uses technology to actually identify the root cause in the brain. That means you get personalized guidance, which should dramatically improve the accuracy right from day one. And listen, this isn't some idea that just popped up overnight. The Neuroanalytic agent is built on a rock-solid foundation. 3 decades of validated, peer-reviewed scientific research in a field called neuroanalysis. This has been in the works for a very long time. This all sounds incredible in theory, but how does it actually work? I mean, how can an AI platform possibly decode what's going on inside the human brain? It all boils down to a 3-step process. First, and this is the amazing part, the AI acts like a translator. It takes the patient's symptoms, things like anxiety or I can't focus, and translates them into the objective language of brain function, mapping them to specific neural patterns. Then, step 2, it uses that framework to identify the likely root cause and generate a brain-based diagnosis. And third, that diagnosis isn't the end. It's the beginning. It gives the clinician a biological roadmap to design a therapy plan that's truly personalized and much more likely to be effective. But even the most revolutionary technology is only an idea if it's stuck in a lab. So how do you actually get this out there into the clinics where it can help people? The plan is to roll this out in phases. The first year is all about working with early adopters, those forward-thinking psychiatrists and clinics, to prove how valuable it is. In year 2, the focus shifts to bigger partnerships with entire healthcare systems and insurance companies to really broaden its reach. And then, from year 3 on, the goal is to go big, enterprise adoption and an international rollout. To make all this happen, they're raising a $5 million seed round. So where does the money go? The biggest chunk, 40%, goes right back into developing the product, making the AI even smarter. Another 30% is set aside for the super important stuff, clinical trials and getting through the regulatory process. You've got to prove it works, right? and the rest is for building those critical partnerships and growing the team. So when you put all of this together, what's the ultimate goal here? If this works, it's not just a new tool, it's a completely new vision for the entire future of mental health care. The vision is as simple as it is ambitious: to completely eliminate trial and error psychiatry, to make it a thing of the past, to give every clinician, everywhere, a tool that can diagnose the actual root cause of mental illness so we can finally deliver precise, effective treatment for everyone. And that really brings us to this final big question. For centuries, psychiatry has been described as more of an art than a science, right? Relying a lot on observation and intuition. But with tools that can actually decode the brain's signals and find a root cause, are we on the edge of a massive transformation? Could this be the moment that mental health care finally becomes a data-driven science? That is definitely something to think about.